Hello, and thank you for inviting me to the HSR UK Conference 2020. I'm Dr. Jo Mower, and I'm Clinical Director for the National Programme and Schedule Care in Wales, and I've been working at the National Collaborative Commissioning Unit. I'm an ED consultant by background and have been working with the members of the National Collaborative Commissioning Unit team for the last 2 years developing an emergency department quality and delivery framework. For emergency medicine, the current measures of the 4 and 12-hour target do not explain the details of the patient journey within the emergency department. Therefore, it is difficult to improve the patient journey when we don't understand the steps involved. We have used a transformational programme called More to improve ambulance services in Wales, and at a very high level, this is understanding activity so we can provide resources to deliver good patient care and outcomes as well as staff experience. Prior to this study, we've had a series of clinical engagement events which has allowed us to develop a set of 20 care standards across a 5-step model of care within the emergency department for all 13 Type 1 emergency departments in Wales. These are summarised on the right-hand side of the screen. There are 5 steps illustrated. Step 1 is when you need emergency care. Step 2 is when you arrive at the hospital. Step 3 is when you're examined. Step 4 is when you need treatment. And step 5 is when you are ready to go. Underpinning each step are 4 care standards that you'd expect for patients as they pass through an emergency department. The aim of this study has focused on developing a suite of national care standards for ambulance handover and triage within Step 2. There are 2 development tools we're using to do this: pathway improvement projects and national enablers for service improvements. We develop a separate PIP for ambulance handover and triage. To do this, there were 2 broad phases to the work. Phase 1 was a rapid review of current standards for ambulance handover and triage within emergency departments, and Phase 2 was a series of national emergency medicine multi-stakeholder consensus and workshop. By writing the pathway improvement projects, we developed the technical detail behind a pathway improvement project. We did this by collating and creating clinical and managerial protocols and procedures. We then designed and agreed the national new policy for emergency departments, ambulance handover and triage. To do this, there was planned implementation groups across each participating site. The national enablers for service improvement involve the development of local informatics systems to record the time to ambulance handover and triage, and to record this nationally. We gathered as much information currently available about ambulance handover and triage across Wales in the series of networking events. There was much overlap, but there was also some individual departmental practice which could benefit other departments. The steps and activities are summarised here in the diagram on the right-hand side. We were able to describe consistently what we mean by triage, describing a Stage 1 and Stage 2 triage. Stage 1 is focusing very much on delivering a Manchester triage score, pain relief and time-critical interventions for each patient that is triage. Triage Step 2, or streaming, may involve a little bit more activity within that step to get the patient to the right place at the right time. This may be within the emergency department, such as a majors or minors stream, or outside the emergency department by referring the patient to same-day emergency care facilities or hot clinics. By networking, sharing good practice across Wales, it is intended that these standards are used to develop the service operationally. Thank you for listening, and if you have any questions or comments on this presentation, please get in touch. Thank you.